All right, so without wasting further time, let's begin. And I hope all of you have some knowledge about where, as a candidate, you begin the speaking, right? In general, if you have seen other language tests, generally examiner starts speaking. But here in this test, candidate, that means you will begin speaking. And just for the information that interlocutors are not your examiner. Okay, with whom you speak is not your examiner. They are ideally English speakers, English teachers, who is specifically trained for medical English. Okay, and they don't have much medical knowledge, like your patients, right? Your patients also doesn't have medical knowledge, and they also don't have they are also not judging you, right? So same way interlocutors don't give you any score. Okay, they just help you to maintain your communication, being a patient or a carer. Okay, so let's see one of the assessment criteria, and that is relationship building in OET speaking. And this time, I really want you to participate in this meeting. Okay, even if you are new, even if you are making errors, that's all fine. Okay, but at least give your attempt. Okay, so let's see what are the indicators for relationship building. So they assess you based on four things. The first is initiating the interaction appropriately. That means, according to the given situation, you need to begin the role play card. Okay, you need to start the speaking. So OET examiners assess you that how you begin your interview. Okay, that includes greeting, introductions, nature of interview. So your beginning would be based on the nature of interview. Okay, we are going to look at each of these tasks in detail. Second is demonstrating an attentive and respectful attitude. So, whenever we deal with therapeutic communication, it is essential to be attentive and respectful towards the patients and their relatives, right? And we need to be non judgmental and always show empathy for the patient's any kind of negative feelings. Okay, so let us begin with the first task, and that is initiating the interaction. Okay, so here I would like to give you three scenarios, and I want you to participate. I want you to participate in this task. Okay, so here is the first scenario, and I want you to begin. Any volunteer can take part in this. This 18-year-old student has presented with complaints of tiredness, sleeplessness, and stress over upcoming exams. He or she is seeing you for advice on its management. And your first task says find out the reason for patient's visit. So, can you just think that in this circumstances, how will you begin the role play card? Anyone can unmute uh, yourself and then you may start speaking.
First of all, we will greet the patient,
Yeah.
then we will introduce ourselves,
Hmm.
and then we find out the reason that may I know your reason for visiting here?
Yes. Fantastic. So, this seems like a totally new patient, right? Any information
Yes.
doesn't represent that we have already met the patient earlier. So, in that case, it is important that we introduce ourselves. And as the scenario seems stable, there is no any urgency or anything, we may also get introduction of the patient. Okay, let's assume that this is the clinic. Okay, and this is a stable patient. So you may start by introducing yourself. You may start by greeting the patient, then introductions from both the ends, and then you may start with the first bullet point. So you may say something like, Hello, good evening, Mrs. Okay, if you know the name in advance, okay, sometimes it is suppose ward, and we may assume that we know the patient at least by name, but we are meeting for the first time. So, in that case, you may just confirm that you are talking to the right patient. Okay, so you may say something like, hello, Mrs. X. My name is Kirti, and I am one of the registered nurses on duty today. You are Mrs. X, right? Okay, so could you please tell me what brings you here today? Yes? Or do you have any other way of speaking for the same scenario? I'll be your interlocutor if you want to make it two-way. Yes, can anyone try, please? Yes, Sheetal, can you try? Hello?
What's bring you here today?
Yeah, that can be the question after greeting and introductions, right?
Yes.
What brings you here today? Yeah, that also can be a question. But first of all, it is important to greet the patient, get the introductions, and then moving towards the task. Okay,
Yes, ma'am.
like you may say, good evening. My name is Kirti. I'm one of the registered nurses on duty today. May I know your name for the confirmation, please? Okay, so you may ask the name or you may just confirm the patient's identity. Like you are Sheetal, is that right? So that is how you may either confirm the identity or you may ask the question that how may I address you or may I know your name for the confirmation, please. Okay, like this you can get introduction and then okay, Sheetal, please tell me what brings you here today, right? Does it make
Ye-
sense?
Yes, ma'am.
Okay, now I am just twisting the scenario little bit. Okay, the same scenario, but read it again now. This is different, somewhat different. This says that this 18-year-old student presented a week ago, complaining of tiredness, sleeplessness, and stress over upcoming exams. He or she does not have any other symptoms. You ran some tests, and this is a follow-up visit to discuss the reports. The bullet point says confirm the reason for today's appointment to discuss reports or further advice. Okay, so based on this information, what did you understand?
Patient is known.
Yes, the patient is known because patient presented to us a week ago, right?
Okay.
And
Yes.
this is a follow-up visit which further confirms that we are known to the patient. Yes. So according to these circumstances, do you think that we need to introduce ourselves?
No,
No,
ma'am.
ma'am.
No. Then how can you start? Just
First
imagine, just
greeting.
imagine the scenario and put yourself in a real situation. See, this is the role play. You are playing an act, but not physically, right? So just assume yourself that you met an 18-year-old student, yes, a week ago, and you are meeting again, right? So what will be your expression?
Good to see you here.
Yes. Okay, but can you use something else before asking the question? Suppose I'm meeting you for the second time, and will you start directly by good to see you again? Do you think so?
First
How
of
are
all,
you?
greeting.
Yes. One by one, I'll ask
Uh,
everybody. Yeah, I'm happy to see your. Yeah, please begin. Urvashi, let's
first
start
of
with
all,
you.
greeting. First of all,
Yes.
greeting and confirm identity.
Why should we confirm the identity? In this case, I don't think so that is appropriate. Okay, we believe that we can recognize the patient after a week, right? Patient is coming
Yes.
again. We have all the patient's notes. I know practically it is little bit difficult to recognize all the patients even if we are meeting for the second time. Yes, but according to OAT, we should assume that okay, we know the patient. And it's okay if you want to
And
confirm, but make sure that your tone is friendly little bit. Yeah.
yes.
Yeah, can
Then
you try?
confirm.
Just be the
Yes.
patient and try.
Hello, good evening.
Good evening.
Uh, are you Kirti? Is that right?
Yes, that's right.
Uh, so could you please tell me tell me the reason for today's visit?
Okay. Do you think this is an appropriate question? See, this is the planned visit, right? This is a follow-up visit. And it is clearly mentioned that patient is here to discuss the report. Yes? Sheetal, can you try?
Yes, ma'am.
Yeah, try it,
Good
please.
good evening.
Good evening.
Are you Kirti? Is it correct?
Yeah, that's right.
How are you?
I'm good. Thank you.
Okay, so you are here for discussion about reports and further advice. It is correct? Is it
Yes.
correct?
Yes, that's right. Okay. So fine, good try, but be little bit more friendly. Like even if you are confirming the identity, see, it is actually not needed. But if you want to, you can. But your tone has to be friendly in that case. Okay. Instead, you may ask the interlocutor in advance that how may I address you during the role play. Okay, because we know that we in this role play card we know the patient already. So suppose patient said that call me Kirti. Okay, so you may start something like, hello Kirti, nice to see you again. How have you been doing since your last visit? Does it make sense?
Yes, ma'am.
Okay, so keep your tone little bit friendly because you are meeting the patient for the second time. Okay, nice to see you again. That gives confirmation that we have understood the task. Okay, and this is the way when we meet the patient for the second time, the way we communicate, right? So nice to
Yes.
see you again. So from your case notes, I have understood that this is the follow-up visit because you underwent some tests in your last visit a week ago, and this visit is a follow-up, and we are about to discuss about the reports, right? Okay. Or you may ask open-ended question for the bullet point. Confirm the reason for today's appointment. Would you mind telling me about your understanding regarding today's visit? So patient will tell you that yes, I came a week ago and underwent certain investigations and I'm here to know the outcome. Okay,
Yes, ma'am.
fine. Now let's see the third scenario. This 18-year-old student has presented with complaints of tiredness, sleeplessness, and stress over upcoming exams. You have just taken their vital signs. Find out patient's concern. So, do you think in this case you need to introduce yourself?
No,
No, why?
because we have just taken their vital signs.
Yes, that shows that our previous conversation has already completed. Yes, we have already graded the patient. We have already had introduction with each other. Okay, so initial conversation is over. So we presume that that conversation is over. We have assessed the patient's vital signs, and now we need to start the conversation from this point. Yes.
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 Hmm, sorry. So now the second point is be attentive and respectful. Okay, towards the patients. So let us see what all tasks we can cover here. So I have divided these things into under three headings. Okay, suppose how to be attentive. Can you give me some examples? Like if you're attentive, how can I understand that you are attentive in the class?
We can give and we give all the
Yes.
answers.
Yes, if you are giving me answers, then only I'll be able to understand that yes, you are in the class, you are attending, you are listening to me, right? Or sometimes you may nod the head, yeah, okay, okay. Or sometimes we say, right, okay. So that will help me to understand that yes, you are attending. Similarly, when you speak with your patients, we do these all gestures, okay. So for OET speaking, you need to do that. And here, you have to be respectful. So being respectful is like making polite requests. Suppose you want to make a request, okay, to the patient. So how will you prefer to do that? Any kind of request you want to make.
May I?
Yes, okay. May I? Yes, may shows the respect towards the patient. Okay. And here a little bit converted. Would you mind if I ask you a few more questions regarding your lifestyle? Okay. Instead of using, tell me more about your lifestyle. Okay. So tell me more sometimes sounds like an order. Okay. Tell me more. Instead, if you will use, would you mind if I ask you a few more questions regarding your lifestyle? And then you may begin by asking questions one after another regarding lifestyle. Okay. And
Yes.
also you can make use of connected speech. Would you mind? Would you mind? Would you mind? Okay, that is connected speech. Okay, words are joining. Would you? Would you? Would you mind if I ask you a few more questions? If it's okay. It's okay. It's O is connected. If it's okay. If it's okay with you, could you discuss more on lifestyle? Yes? Can you
Yes.
try? Do it. Okay, let's see another thing, polite suggestions. Suppose you want to give suggestions on exercise. Okay, suppose you want to say that you do daily exercises. How will you do that? How can you tell your patient that do daily exercises politely?
I recommended you to do daily exercise.
Okay, that sounds good. I recommended is past tense. Okay, like I recommended you in the past to do daily exercises, but here you are giving suggestions. Okay, I recommend you will be okay still. Okay, I recommend you to do, but keep your tone little polite. Okay, I recommend you to begin with 15 minutes of walk, right? Okay, any other way? Okay, let's see here. What do you think about exercising daily? Right? We are trying to understand the patient's perspective. Okay. And also it changes into the politeness. What do you think about starting with exercises? What do you think works in your life? Give correct space. What do you think? What do you think? What do you think? What do you think? Okay, if you practice, you will get it. Okay, nothing is impossible. So, how about starting with 15 minutes walk? How about starting? How about A is silent. How about starting with 15 minutes walk daily? Okay, suppose patient refuses that I can't do, I don't have time. I'm pretty busy. So you may say, how about starting with 15 minutes walk? Yes? Are you getting me?
Yes, ma'am.
Yes. And the most difficult one is politely saying no to the patients, right? And that is really, really tricky. And under certain circumstances, like if you're a nurse and patient asks you that you make a diagnosis, okay? Tell me whether I have asthma or not, okay? And you need to resist the request, okay? You will see the task in the card that resists the request to make a diagnosis. So I would also always recommend that you give the rationale first and then say no. Okay, don't directly say no to the patient that no, I'm not the authorized person, I can't do this. Rather, be polite. Please try to understand. It is beyond my scope of practice, and therefore I cannot, give you final diagnosis. Okay, or you may say something like this: although your symptoms are consistent with diabetes, it's hard to comment before investigations. So here we have not said no yet, okay, but
Yes.
we have just given the reason by which it is obvious that we are not going to give the diagnosis. Okay, although your symptoms are consistent with diabetes, it's hard to comment before investigation. It's hard to comment means no. Okay,
Yes.
I understand your concern regarding possibility of having multiple sclerosis, but it's beyond my scope of practice to diagnose. So ultimately you are saying no, it is beyond my scope of practice. That means no in this case, right? And then you are giving what will happen the next so that the patient will be calm. Okay, doctor will first assess you, then they may advise some investigations, and then will provide you final diagnosis. Ultimately, no, I can't tell you whether you have multiple sclerosis or not. Okay, so be, indirect messenger to say no in your speaking. Okay, rather than directly giving the approach that no, I'm not the authorized person. Instead, you say that it's beyond my scope of practice, so it's really hard to comment on diagnosis. Okay, does it make sense?
Yes, ma'am.
I hope it will be very, very helpful if you come across any such communication. Now, the third point is being non judgmental, and this is also extremely difficult being an Indian, right? Because we always judge people, I know. So instead of I have just changed some sentences that we generally use. Even in writing also you need to be non-judgmental, and both in speaking as well. So the first statement I have taken here is you have no control on diabetes. So this seems really rude to the patient. Okay, this is kind of a blaming sentence that you don't have control on your sugar at all. Okay, instead you say the give the factual information rather than being judgmental. Okay, you may say that your blood sugar levels have been high recently, so that is what you are assessing as a medical professional. Okay, whether patient consumes high sugar or not is secondary, but according to our observation patient's blood sugar level is high, so give that information. Okay,
Yes.
second, you are alcoholic. You are heavily drinking. Again, this is judgmental, right? Patient don't feel good with your responses. So instead, you may say your alcohol consumption has reached to harmful levels. Okay, or it has reached to unacceptable levels. Right? Third is you are an obese person. This is very commonly seen in the real world. Okay, see how obese she is. Right? But instead, you may say that your BMI is quite higher than normal limits. Okay, that sounds really good to hear that it is quite higher. Okay, even if it is high, but you can't be judgmental towards the patients. Okay, you are a heavy smoker, stop smoking. No, you can't do that with your patients. Okay, you should stop smoking because excessive smoking can lead to health hazards. Yes, fine. And last one, so you don't take the medicines on time, right? So this is generally happens when we are paraphrasing the information. Okay, patient says that I have taken all the medications on and off, and I'm having these symptoms. So when you are trying to paraphrase the information given by the patient, we generally make mistakes of, okay, so you said that you don't take medicines on time, right? So again, this is a firing statement. Okay, what I have understood is that it's hard for you to manage taking all the medications as prescribed. Am I right? Okay, so be careful when you are talking with your patient. Make sure that you maintain therapeutic communication. Okay, and also one area where students generally make mistakes or we are lacking because if I talk practically, how many of you believe that we are empathetic towards the patients at bedside? Do you think we can be empathetic? Do you think yes or no?
In some situations, we will.
Yes, in some situations it
50-50.
is okay. We can be. Okay, but not always. If we are too much empathetic, probably we may not focus on our work. Okay, if I'm having lots of feelings for the patients, how will I be able to perform wound dressing? A serious one. Okay, think about burn cases. Okay, if I'm too much empathetic, it will be hard for me to focus, right? So still, when we are communicating, we will make sure that patient should feel that they are heard. Okay, they are attended, and we are there to understand their feelings and to do everything possible from our side. Okay, so let us see the first scenario, that is, I pressed the buzzer several times, but you didn't come. Where were you? So patient can be angry. Okay, patient can have any kind of feelings, but make sure that as a medical professional, you are down to earth. Okay, so here what you can say, I pressed the buzzer several times, but you didn't come. Where were you? So what should be your response? I can completely understand that you are annoyed, but I was really busy with so and so tasks, right? So you will explain the circumstances that why you were unable to reach, and you have approached the patient's concern that I can understand that you are annoyed. Annoyed is little angry. Okay. In second scenario, patient says that I'm afraid donor will never be found in time. Okay. So I can understand your fear, but please try not to worry because we are trying hard to find the donor in time. Okay, I can understand your fear. So try to understand that what kind of feelings patient is giving to you, and based on that approach the patient. Okay, in the first scenario, I can understand that you are annoyed. In second, I know you are afraid. I know your fear. Okay, I never imagined myself without a lower limb. Understand patient underwent amputation and seeing for the first time herself or himself. Okay, and patient is not able to accept uh, the body image he or she may have. Okay, and patient says that I have never imagined myself in this situation. Okay, I know you are in shock. Okay, and I can completely understand how you must be feeling right now, but please try to understand that it was really necessary. Okay, Let me give you fourth scenario. I was so embarrassed that I couldn't pay attention to what the doctor said about pilonidal sinus. Now, pilonidal sinus actually occurs into the lower back. Okay, and patient said that I was very embarrassed that I couldn't pay attention. Okay, so I can understand your embarrassment, but you should not feel embarrassed because we medical professionals are dealing with range of health related issues every day, so you are always free to ask your questions. Okay, so approach the patient's feeling. I'm fed up of this delayed recovery process. Okay, I'm really fed up of it. Now you may say that I can understand your frustration. Okay, but see, we are trying hard to recover your wound. Okay, we are trying everything. We are changing your dressing. You have been prescribed antibiotics, and I hope that recovery, although it is delayed, but recovery process will take little time. Okay, so please don't get frustrated. I lost my husband last year. My kids live abroad, and because of this illness, I have lost contacts even with my friends. Now, this situation shows that patient is lonely and isolated. Okay, so I can feel your pain. I know you feel very lonely and isolated, but please try not to worry about, because we will help you to get connected with various groups where you can find your friends. Okay, and we will also make arrangements to communicate with your children. Okay, so please try to be relaxed. And here, last two situations, sorry. If I would not have drive fast, I would have saved my friends' lives. So suppose patient was driving a car, he met with an accident and lost the friends who were there in the car with him or her. Okay, and here patient feels guilty, regret. Okay, so again, I can completely understand your loss. Okay, but at the moment we need to focus on your health. Okay, I can understand that it's hard for you to accept, but we need to do this. Okay, whatever the circumstances is given, you can try to explain. Eighth, I don't think so I will be ever able to stand back on my feet. Now you need to see what kind of circumstances are given, whether patient will be able to stand back or not, and accordingly you can convince the patient. Okay, whatever comes to your mind, you will text me, or whenever I am posting this video on YouTube, you will have to write it into the comment box. Okay, that what response you will give for this eighth bullet point. Okay, I hope it is clear.
Yes, ma'am.
Yes, so
Yes,
be
ma'am.
empathetic towards your patients, okay, and be non-judgmental and supportive towards your patients. Begin your role play card according to the given circumstances. All right. So just make sure that this is how you can build relationship with your patients. Okay. That's all for today's class, and I'll be meeting to you online on next Saturday. Till then, bye everybody.
Bye, ma'am.
Bye.
Bye, ma'am.
Bye.